Okay, everything is up and running.
Hey everyone, I see we have 10:30. I will call a meeting of the neighbors of Dunn County to order. First on the agenda is roll call. Let the roll reflect that all are present except for Supervisor McCulloch. Approval of minutes from the July 15th, 2021 committee meeting. Is there a motion to approve?
So moved.
Sarah moves, Mike seconds. Are there any questions on the minutes?
No.
Hearing none, all those in favor say aye.
Aye.
Aye. Aye.
Opposed? Carried. Okay, then we'll approve the minutes from the July 20th, 2021 special meeting, special committee meeting. Is there a motion to approve that meeting?
Move to approve.
Supervisor Kennedy moves to approve. Is there a second? Supervisor Jensen, are there any questions on the meeting? Hearing none, all those in favor of approving say aye.
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 Opposed? Carried. Is there any public comment?
No public comment.
Okay, thank you. We'll go into Carmen's administrator report, please.
Thank you, Supervisor Johnson. All right, so as always, Quality Assurance Steering Committee report. So we met last week to go over our Quality Assurance Steering Committee. We go over all of our normal things, our metrics, falls, infections, wounds, injuries, anything like that. We also went over our Safety Committee report since it was postponed from last month. So that was an added report this month. We went over the East Survey Life Safety Code because that is part of the Safety Committee. So went over the audits that we have been doing, and we'll be doing those for one more month for the couple of minor citations that we received in the East Survey for Life Safety Code. Everything is looking good for those, as well as for those citations that we did receive in the East Building. We made sure to correct those issues anywhere else on campus that they also appeared. So for example, one of them was the level of the sidewalk. So the facilities department went around campus and made sure all the sidewalks were level so that we wouldn't receive those citations in the other two buildings as well. So they were preventing those from being citations in more than just the East Building. We also went over the Medical Care Committee report. So all of the quality metrics, like I mentioned, falls, skin tears, wounds, anything like that, infections, psychotropic medications, and their monthly report, as well as a quarterly report. There was nothing out of the norm, no trends of any household that had more falls than others, or on any specific shift or anything like that. So it all went well. We also went over COVID updates, which we'll get into a little bit later in this meeting as well. Any questions on Quality Assurance Steering Committee? Okay, I'll move on to the Employment Activity Report, and I'll have Chris go over that.
Good morning.
Morning.
So for the month of July, the types of recruitment were the same. Our county website, NeoGov, and Facebook. July was a little slow for interviews. We had 6 interviews scheduled. That's for in-house hires. 6 interviews held, positions offered was 6, and accepted were 6, and accepted higher than a step 3 was 2. We did have bring 2, or actually ended up bringing 1 RN on, the other one declined before orientation. So we did make 2 offers that were higher than a step 3. For resignations, we did have 10 resignations in the month of July. Kind of the reasons are listed here. The big one that you'll notice is we did lose 3 nurses to Mayo. And then we did have a different, we did have the rest of them were the CNAs that had resigned for the various reasons that I had sent out on the report. Open positions are, fluctuated a little bit with the people that had left. So those were changed a little bit. For July, we were still having, the agency staff was still pretty hard to secure. That has taken a little bit of an uptick for August. We have Paula's in here with me off camera because I can only angle it so much. We have had a few agency staff that we were able to secure for August. So that was a good thing since we did lose quite a chunk of our student CNAs that went back to school. The leaves of absences for July, the educational related was a 7. They kind of had started up for July leaving for school. August will show approximately 16, I believe, that are out on a school type LOA. If we get down to work comp lost hours, you'll see in the CNA column that we did lose 123.5 hours due to a workplace injury. Those weren't like non-productive hours because the staff person was here working on a light duty basis. So they weren't completely lost. They were just more of a non-productive type. They weren't actual CNA hours. So if you get down to the bottom in the red, for the shifts missed for COVID-19 issues, we missed roughly about 17 shifts, kind of a mix of the 8s and 12s like I had talked about last month, or roughly 160 total hours were missed to COVID-related issues. Anybody
I
have?
can add something really quick. So those 10 resignations were some of the ones that we talked about last month when we went over at our special meeting when we were talking about the need for PM homemakers, and then as well as the wage discussion that we've had the past few meetings. So because these are a month behind, because we're having almost halfway or more through the month of our meetings, so we're looking at the previous month. So these are the ones that we were referring to last month, because most of those did come in at the beginning of July. So we did discuss those as well. So this is what we were alluding to of July being a really rough month.
Mr. Chair,
Yes, Mike.
a question of, I guess, Chris and Carmen. I know that you talk to people when they leave. I'm wondering, do you ask them, what could we have done to have kept you?
That is one of the questions that we do ask. And then we also ask if
And-
you would consider returning.
And what kind of responses do you get to those two questions?
It kind of varies. So on this list, with the 3 that left for Mayo, it was primarily due to wages as well as the amount of weekends and holidays that are worked. So they do every 3rd weekend instead of us doing every other. So that was their reason for leaving. And then the CNAs were kind of all different reasons. So it was, some of them were family related things. Some of them were leaving because of not liking policies. That was a couple of them that had concerns about that, as well as scheduling and being short staffed. That was having better staffing was part of the things that they said they would help them stay. But unfortunately, the more people leave, the harder it is to have better staffing. So it's kind of just a vicious cycle that we get into.
So things they said, well, if you had better staffing, if I only had to do every 3rd weekend,
Correct.
that would make a big difference. Is that more of a draw or than salary? Did they say, well, you pay me this much, I'd stay, but these two things are more important than salary to them, do you think?
I think it's kind of a combination of all of them. So it's the salary. So if we had paid them the same that Mayo did, there's still those couple of extra things that add on to that. So it would be, we'd need to pay them that much, also have the every 3rd weekend and have the scheduling concerns fixed as well. So, and that's specifically for the 3 RNs that went to Mayo was those reasons across the board. So.
Okay, thank you very much. That answers it nicely. Mr. Chair, would this be a time I can ask about the CNA training, or is there some other item that would be better?
Oh, have at it, Supervisor Kinnear.
Sure.
Well, Carmen, you told us that due to your persistence, I think, that we did get permission to do it, but then you said we needed to write curriculum. Where are we at right now?
So unfortunately, that nurse that Chris mentioned, being the nurse that after accepting an offer, she was supposed to come to orientation and then postponed that due to being out on a personal leave at her previous job and wanting to continue that leave, and then postponed it to this orientation. And then this week before we had orientation yesterday and today, and we found out this week that she accepted employment somewhere else in a different area, at, I believe, a hospital. So that was our person that we had been a CNA trainer in the past. And we were going to, I think we talked about this last meeting, that we were going to use the curriculum that she would know, since instead of reinventing the wheel. So we will be working on creating our own curriculum because she will no longer be coming to us.
Okay, thanks. Somebody will be working on that. Does that mean the head administrator?
It'll probably
But
be
no,
a
I
combination of
just-
myself and Paula and the other nursing managers.
Okay. Well, having written curriculums multiple times, usually you just steal them and adjust them. Is that about it, isn't it?
Yeah.
So
there
Sarah's
is-
chuckling, but yeah.
Yeah, there is a requirement of different items that must be on it. So it's there is a pretty set in stone. This has to be trained about. This has to be trained about for however many hours. So just pulling that and making it our curriculum and sending it in.
Thank you very much.
Can I just say one thing? Am I on mute?
No, we're unmuted.
Can I just say something quick?
Absolutely.
Okay.
Go ahead.
So, yeah, like they were saying, this is the one from last month that we were talking. Since then, we've had 2 additional RN resignations for AM positions. One of them was an AM position on the floor, and another one was our MBS nurse that actually does the submitting of the data that goes into state that drives our revenue. Luckily, we were able to interview and hire somebody within house that we've been able to get her training, but that takes another nurse off of the floor. So we're still in that kind of situation. And like Chris had said, we had 2 nurses coming, but one backed out. So we're still down a couple in that situation, but just wanted to let you know that there were a couple more this past month.
Okay, is there any other questions on that?
Mr. Chair,
Yes, Mr. Bartlett.
like the RNs, for example, were they long-term employees, or were they not here very long that they had built up much retirement?
A couple of them were slightly longer term employees. None of them had been here for like decades, but a few of them had been here quite a few years. And then the nurse that Paula mentioned, that was our MDS nurse who does, MDS is a minimum data set. It's how we get our reimbursement. It's basically filling out a form for each resident that shows how much care they need. And that's how we get reimbursed for the residents. She had been here a long time, 11 years, I believe. And the other nurses had been here for a couple of years each.
Okay, I just, I think that, I think that shows that the retirement isn't as important as we think it is as far as a benefit. Thank you.
Is there any other questions or comments related to the staffing or employment?
Just one quick one. With Stout coming back, do you think you'll get any people, aides and so forth?
Stout's a little bit hard. I know we've talked about this a couple of times. There isn't a nursing program at Stout. So the closest to a healthcare related program is the dietetics program. So we have more luck with homemakers that are in the dietetics program, which hopefully when they come back, that'll help us fill those PM homemaker spots, since that is a really good shift for someone that's in class during the day. And then also doesn't want to be working at, say, like a restaurant or a bar until 2 a.m. They could have a short shift after class. So we're hoping to fill homemaker positions with stout students. But as far as CNAs and nurses, they don't have a nursing program. So we have better luck with CVTC than stout, just since typically CNAs are going, if they're in college, a lot of them are going to school to be nurses.
Two of our homemakers that have started this week are actually stout students. They're for the afternoon shift homemakers, are actually full-time stout students, so.
Good.
I was just gonna say too that, thank you for approving to have the PM homemaker position back again. And as we expected, we had like several applications to begin with, and several of them were no show, no call. We were like all pumped and ready to go, and several of them didn't show, but we do have 2 in this orientation right now. So it is a step in the right direction. So that's huge.
Good.
I believe in our first like 72 hours of having the job posted, I think we had 11 applications. So like Paula said, not all of them showed up for interviews, and we only hired a couple, but it was at least showing more interest than we have gotten in the past when we've posted jobs as well.
Yeah.
Right. There's no other questions on employment. I will move on to the referral report. So the referral report looks a little bit different this month. This was due to having short staff. As we talked about last month, that there's times that we were not able to accept admissions due to not having the staff to care for additional people. We had the staff to care for the people we had in-house, but we had to make decisions to not admit anymore because we don't want the quality of care to go down for residents coming in, as well as that could affect not only the quality of care of the residents, but reputation in the community and referrals going forward as well. So we did have conversations on a daily basis about staffing, what we could and couldn't admit, except if we had people discharged, we would fill just to the amount that we were able to staff. So if we had discharges, then we'd accept admissions, but if we were kind of staying stable, we had times that we were not able to accept admissions. So it looks a little bit different. So we had 111 residents at the beginning of the month. We had 51 referrals. We are seeing more referrals. They had an uptick from what we've been talking about for quite a while of having less referrals. I also do think this is partially due to most nursing homes being in the same position we are, and a lot of nursing homes not accepting referrals or admissions due to staffing. We've heard that across the board in most of the local nursing homes. So if other people aren't accepting, we're seeing more referrals as well, because they're trying to find placement for people who need nursing home care. We had 5 admissions. 46 people did not admit. So we also like to just kind of put on there that, yes, that is 46 people that did not admit to the neighbors. And we did just put on there that we were kind of blanketly not admitting people if we didn't have the availability to staff to have those people in the facilities. But on average, we about 50% of our referrals we don't admit. So not all of them were solely because of not having staffing. We wouldn't have admitted all 46 if we did have the staff, because we have all those other reasons that we don't admit people. They're over the weight limit. They don't have insurance or in-network insurance and all those other things that we go over every month. But instead of having our staff spend the time to review those referrals that we knew we couldn't accept, we had them working on other things. So we didn't break down those reasons, but on average, we have about 50% that don't get admitted based on the referrals we get each month. So about half of those would probably be what we would have turned down for staffing versus other things. So, and we had 106 residents in the facility at the beginning of the month. We had no residents transferred to other facilities. We had 2 deaths this month, and we had 8 people discharged home. So we also, and we'll kind of get to this a little bit later on the COVID stuff, at the very tail end of this month, in the beginning of September, or August, excuse me, we also had a couple of staff members test positive for COVID, which, as you can recall from last spring or this past spring, we are not able to admit if we have positive COVID cases in staff in the households they worked in. So that also hindered admissions as well as the staffing situation. We have had a few admissions in the last couple of weeks. So we are refilling any beds that we had people pass away, as well as if there was any discharges. So we're trying to keep it at the level that we can staff as full as possible with our staffing abilities at this point. Our referral sources were the same as usual. All three of the Mayo System hospitals, as well as Sacred Heart, which isn't listed there, but the top three were Eau Claire Mayo, Menominee Mayo, and Rochester Mayo. We have seen a few more referrals from Rochester, which is primarily due to Menominee and Eau Claire not having beds available, and people that would normally not need to go to Rochester being in Rochester because the beds are full in Menominee and Eau Claire. So we are seeing that hospital influx as well. That was similar to what happened last year when COVID was at its peak. Are there any referral questions for me at all?
One quick question.
Sure.
Is 111 a number that's about the max we can staff right now?
Yeah, that's probably pretty close. It's kind of a day-to-day basis that we check on them, and it also depends on residents' acuity. We're keeping Fireside to the amount that can be staffed with one CNA, which is about 9. And we have in Fireside, and then if the rest of the households are pretty much full, we're keeping them right about full, but just based on the amount of staffing. It also, like I said, depends on acuity. If we get a referral that is someone who is a one assist or even an independent person, but still needs help with medications or their shower, things like that, but still needs nursing care, we may be able to have a couple more than if we have everybody that is a total dependent care Hoyer Lift 2 person, just because that does take more staff time. So we do have to be cautious of that as well. And households that already have a bunch of people that are 2-person assists that take staff time, we're trying to keep the level of care manageable for the amount of staff too.
Sure.
Thank you.
Any other questions on this? All right, next on the agenda is the environmental and facilities report. So I'll have Scott take that one.
Good morning, everyone.
Morning.
So for facilities and environmentals, everything has been running pretty smooth. No huge hiccups over the past month. Our biggest highlight, I guess, would be the survey in West Building. And I see Carmen has that further on next on the agenda here, but I just wanted to bring up our West survey for facilities for life safety code. We did very well. We ended up with one site for a sign that was sitting on the floor, leaned up against the wall. That, and then the engineer also did some FYIs. Basically, I kind of get the indication that from our past, the way Bill Harmon handled things has had everything documented, everything to a T. Our engineer referred to Bill Harmon as top notch as far as taking care of the facility. And Josh has followed everything that Bill had set in place. And I think Josh is following to be top notch also. So Ryan, the engineer, gave a couple of FYIs, just things, notes that he wouldn't cite, but they're things that if he sees again, he would cite, but it's just a note to get them taken care of, minor things. So all in all, the survey was very good for life safety code. Josh went ahead prior to state coming in for survey and went through everything he could, everything he knew of to take care of. So he did quite well. He's fitting the position very well. Other than that, business as usual, doing the work orders, repairing minor things as they come up, keeping the grounds looking nice, keeping busy every day. Does anyone have any questions for me? Thank you.
Thank you, Scott.
All right, as Scott said, next on the report is the West survey. And since Scott was just talking about facilities, I'll just kind of go on that and then go over to your life safety code and then go over to health side of survey. So as Scott said, we received one citation. It is a minor citation for life safety code. So it's a D level, which is the lowest level of like a citable with a plan of correction tag. So it's just an isolated case of something that didn't cause any harm to anybody. It could if there was an issue, but it didn't. So basically the sign that Scott was talking about was a sign saying this is an emergency exit, and it just happened to be sitting on the floor slightly in front of the emergency exit door. It was a 9x11 picture frame, so it wasn't going to inhibit anyone from going out of the door, but since it was technically blocking a means of egress, we did get cited for that. So that was immediately fixed by removing the sign. And we will write a plan of correction that shows that we removed the sign, and that will be resolved. So that was the life safety code. As Scott said, Josh has done a really great job of filling Bill's shoes in that and had 2 successful surveys. Our surveyor did say that his average citation post-COVID is 8 citations per survey is what he's been averaging. So having 1 very minor citation is a really good survey for life safety code. So I'm very happy with that and the performance of Scott's team. So it's awesome. And then on the health side of survey, we actually received a citation-free survey for the health side for West. So we're very proud of that as well. The team over in West and the whole campus worked really hard to make sure we got all the surveyors all the information and everything was documented well, and the survey went very smoothly. So they were here for 3 days last week and left on Thursday and was citation free. So the East and West are citation free. So now we're just waiting for Central.
Congratulations to you and the staff.
Thank you.
Very nice. Very nice.
So any questions about survey at all? Okay. And finally, on my report, the COVID-19 update. So as I mentioned earlier, we did have 2 staff members test positive for COVID. They were our first 2 positive cases since February and March, depending on the building. So we hadn't dealt with an outbreak as it is defined by public health and CMS in quite some time. So it was a bit of a challenge to redo one of those since we hadn't been doing them for a while. And previously it was just seemingly we were always in an outbreak of some sort. But right now we have 1 building that has cleared their outbreak. So the East building has had no additional cases. It was just 1 staff member and we had no resident cases and no additional staff. The residents in that building were tested 3 times over a course of 14 days, as well as all the staff across campus. Since we do have times that staff work in different households, when it came to staff testing, we did campus-wide for the outbreak requirement, just in case anybody had worked in a different house, different building. It's just a little bit easier to just go across the board instead of handpicking who has to be tested and who doesn't. And then the Central building has gone through 2 rounds of testing for their positive staff member with so far no additional positive cases, no residents, and only that 1 staff member. And they will have 1 last round of testing next week and then hopefully clear that outbreak if we have no additional cases. So we are, it's looking hopeful for that, and it was positive for the East building. But we do anticipate to continue to have more positive staff cases, just like we did throughout all of last year and into the spring of this year, just due to the increase in positive cases in our area. So it is something that we monitor on a daily basis of our positivity rate. So our regular routine testing, and then obviously our testing if we have outbreaks, and all the protocols that come with that. In addition to COVID-19 cases here, there has also been quite a movement in COVID-19 policies and statements that have come from CMS and the government in the last couple of weeks, and specifically yesterday. I'm not sure if all of you saw the news last night, but CMS and the White House have both released statements regarding mandated vaccines for nursing home employees if a nursing home accepts Medicare or Medicaid dollars. So that would include us. They have not come out with the actual rule. It is going to be considered an interim final rule, which is CMS lingo for a new regulation. And it is put into effect kind of off cycle from their regular rules. So we are waiting for that. They're anticipating that to come in September is what they said. They didn't say like September 1st or end of September, just sometime in September. And to have more specifics about what that really entails. We don't know if it's going to be just straight across the board, everyone must be vaccinated, or the money is cut off, or if it is more like what some of the healthcare systems in our area have done, where it is mandated vaccines, but then there's also different exceptions to that as well. So we're waiting to hear more details, but we do anticipate that shortly.
How many, may I ask a question, Carmen? What % of the staff is not vaccinated now?
When we did our mass vaccine clinics here, we had about 70% of our staff vaccinated at that point. I don't have an up-to-date number for today of since then, based on people that have left and new people that have come. But we do keep track of everyone who isn't vaccinated. And then like when the surveyors were here last week, they did ask us who in the West building for both staff and residents that were not vaccinated, and we had to give them a list. That building, all the residents are, but as far as staff, we did have some, and then they actually pulled random names of that list, and we had to show that we had offered the vaccine and that they had a declination form saying that they did not want it, as well as education that we have given to them. So we do have declination forms for those people, and then they basically saw it that they were educated, that they were offered the vaccine, and that there was documentation that they declined it. So I'm not sure how that'll work going forward, depending on what the final rule says for the requirement.
It might not be good for your employment either.
Yes, that is our biggest concern with this, is that it is just nursing homes that were given this final rule. So CMS oversees more than nursing homes. So Medicare and Medicaid, they support home care, they support hospice, hospitals, clinics, anything that is Medicare or Medicaid certified receives dollars from the state and the federal government through CMS. So it's difficult for us because we aren't the only ones that are provided that money, but we were the only ones that were told you have to be vaccinated or you're not going to get that money. So for example, if we have a CNA that's like, I don't want to be vaccinated, hospice is not required to, even though they have CMS dollars. So that is something that the associations are trying to relay to the government and CMS and saying, hey, is there any way to either have it not directly related to dollars or have it not directly just us, having it be everyone that gets CMS dollars from either Medicare or Medicaid, because there are other healthcare options that healthcare staff could go to. So we are a little bit nervous about that. Obviously, the other nursing homes would have to comply just like us. So ALH and Colfax are the ones right in our county as well, would obviously have to do so as well. But all those other agencies and different healthcare entities would not. Mayo has done it themselves, but theirs also is not as mandated as it sounds. They have a lot of exceptions, as well as if someone doesn't get vaccinated, they just have to be tested weekly, which we're already doing here. So that wouldn't be any different than here. So that puts us in a tough situation.
Yeah.
Are there any questions on that at all?
Are there any questions on Carmen's report? Do you have anything else, Carmen, to report or?
Just as a reminder, I mean, this could come by adjournment as well, but that next month's meeting will be on a different date than what's normally scheduled, just due to me being out of the office on our normally scheduled date. So I believe we had it set for,
16th?
yep. The
Monday
15th.
at 10, Monday, right? 10:30.
Yep, the Monday of the week that it normally would have been.
Right. And this is for a very good reason that we're changing it. So,
Yes, it is.
does anyone have any questions for Carmen on the report? Any other questions? And hearing none, we'll go to the 2022 budget. There's Jane.
Hi there. Now, Carmen, are you going to present that like we discussed?
Yes, I can. I didn't know. So as you all have received the 2021 budget, or 2022, excuse me, the 2022 budget, proposed budget. So we have, as it's been looked at a couple of times, the budget that is in front of you is the original first draft. So then we also do have some changes that have come in since then, but that is all in the first, they're not included in the first draft. So as you have approved the PM homemakers, then for this year, for 2021, those were then added in for 2022, as well as the adjusted Medicaid rates aren't shown on this draft as well. So those would go in later. So that it's not the finalized draft, but they'll go in when the overall county does round two all at one time. So it is not the finalized, but that is what was presented as part of the overall 2022 original draft one of the budget. And then if there are any questions regarding that, please let us know.
Mr. Chair.
Yes.
So just to reiterate and make sure I understand that the budget that's in front of you was the one distributed at the county board on July 28th. Importantly, Carmen, confirm for me, does it include the PM homemakers for all of 22 or not?
It does not.
Does not, okay. And then number two, does it include the projected adjustments to salaries for CNAs, RNs, and LPNs?
It does not. It
Okay.
does not include any of the added projections that would be based on the class comp study.
And then the final thing that it does, you mentioned, it does not include is the projected additional revenue from Medicaid reimbursement.
Correct. It does not include that as well.
So, Mr. Chair, it may be in order for the committee to make recommendation, it could potentially be one, that it, on its recommendation regarding the PM homemakers and the adjustments to salaries for the nursing staffs on the information provided on the conservative estimate of increased Medicaid. Do that first, and then, presuming that the committee agrees and recommends it to the executive committee that way, go through the kind of line item review of the remainder of the July 28 version of the budget.
Yeah, that sounds good to me. Would anyone want to address that?
Mr. Chair, I guess maybe if you don't mind.
Go ahead, Keith.
Yeah, Gene has some estimates that we did prepare for the meeting here on those items. Again, these are all things that came up subsequent to information being pulled together for presentation 29. So it's purely a timing scenario, but certainly it is important developments for the committee to be aware of, obviously, when the state gives you additional funding. And this board or committee has gone on record of wanting to add the PM homemakers and address salaries. So Gene did put together some projections working with myself and Carmen. And Gene, if if you guys don't mind, Jane can at least touch on the highlights of where things stand at this point, including those additional adjustments.
That'd be excellent.
Okay, so to start with the PM homemakers, you have the estimate on what that cost. That was from last month's budget. The Medicaid increase, we've heard between 10%, 13 or higher percent increase to the room and board rate. Now, bear in mind, they're still not certain. The department, the Wisconsin DHS is still determining their rate setting and modeling what they're going to come up with. Nothing is for sure. There are 3 models that we looked at earlier this week that, big companies versus the nonprofits are kind of duking it out on the background. But if we have a 10% increase off of our $6,290,000 revenue that's already projected, a 10% increase is substantial. Each 1% is $62,000. So if we estimate 13% instead of 10%, that's another $150,000 to the budget. So it's very fluid. Nobody knows for sure exactly where we're going to land. It should be at least a 10% increase to the Medicaid revenues. So that's good. In the modeling that Carmen and I did with what we know so far about benefits, which excludes the comp and class, we would conservatively be campus-wide above, in the black, about $200,000. But then assuming that comp and class comes in, that would eat that up, and then we would break even, pay our depreciation, and that's, I think, what is expected from the board.
Jane, do you have that on a spreadsheet you can share your screen?
I do not.
Okay.
But
Okay,
Mr. Chair, if I could add, certainly these are positive developments, but again, it is fluid, and we are trying to remain realistic. I guess I've been in this game long enough that you get the public press release, hey, you get a 13% increase, but the devil's in the details, like Jane alluded to. And as they're sorting through and all this posturing takes place at the state level between big organizations, small organizations, all this other stuff, the final actual amount that we'll receive may be less. Hopefully it's more, but we're trying to be realistic here, and that's where we are shooting for 10%. Just to be still relatively conservative and not overshoot.
Well, I agree. That's a good idea. And Paul, you mentioned you think we should go ahead and don't you think we should add this in at the end?
Actually, I would recommend you do it now because the budget then that you're going to be looking at doesn't include any of this.
Right.
So you predicate your review on something that's the new information. It really doesn't matter, Chairman Johnson, whichever you're comfortable with. By the way, when did you add an M to the end of Johnson? I think that's very clever of you.
I don't know where that come from.
Anyway, either way will work. I just thought as long as we were making note right up front, while it's fresh in people's minds, the bottom line, the recommended PM homemakers, the recommended adjustment to the nursing staff salaries should be on a conservative projection of the estimated Medicaid increase, Medicaid reimbursement, be covered without needing to throw us into the red and rely on the general fund to balance operations.
Okay, go ahead, Dave.
I didn't catch the figure for the homemakers and the added expense for the benefits and stuff and wages.
So I don't have it in front of me. That was from last month's budget adjustment.
The PM homemakers, I believe, were in that $211,000 range, if I remember correctly.
Yep.
So it was in that ballpark, Chairman Bartlett. As far as the benefit changes, that were identified as an update that will be coming in round 2 for health and dental, Wisconsin retirement system updates. Those are part of a whole package that are being pulled together. So it hasn't necessarily been broken down, but it is a reduction. Health insurance will be going from an 8% to a 0%.
Okay, this, what we've got here in front of us includes a 2% increase in wages, correct?
Correct.
But it has no other increase for what we're thinking might come out of the comp study.
That's correct. Yeah, round 1 did not have any of that. We didn't have direction. Keep in mind that information is compiled in April and May, and then reviewed in June and July for presentation in July. So, and most of the things that we're talking about here are subsequent things that have come up in June and July, and that's a natural part of this process. Unfortunately, if you have substantive changes that come up subsequent, that's why we wanted to at least prepare in general where we're projecting things to be at this point.
And what census are we using with this budget?
Excuse me?
What census, average
census?
census?
Occupancy rates.
It's an aggressive census like it was last year. We did change the payer mix to reflect the trends of increased Medicaid census, decreased private pay census. And that seems to be right on track of what's still happening. And to our benefit, if Medicaid rates increase, then we'll catch up faster, I guess. It's not a bad census mix that we're looking at.
Okay, I didn't hear the number of the census that you're figuring off from.
The number of our census is, each building has a different census summary.
Well, we've got 111 that we can have in there. So what's the total?
I will get that for you in just a minute.
Okay.
One thing to point out, and Carmen, maybe you can touch on this as well. One of the things that we've talked about in this unique time with COVID and everything else is how to budget. Do we budget like we're in COVID operations, or do we budget like we're in normal operations? That was the direction last year in preparing a budget, was let's budget like we're in normal operations, because we don't know. And I think we took the same approach this year for the 22 budget, because hopefully we'll be out of it or largely out of it by the end of this year, early next year. But again, we just don't know. Is that correct?
Correct. Yep, so that is what we did. That's what we did last year for the current fiscal year's budget, is budget as if COVID was not a thing. And then as that was the direction for the overall county, because we didn't know that we would still be in COVID or not still be in COVID. So budgeting as though it wasn't an issue. And we did that for 2022 as well. At this point, when we did put in the original numbers, we were not having quite as drastic of a staffing concern. So I know our current limitations with admissions isn't directly related to COVID. I do think it is partially related to COVID due to COVID burnout from staff has been part of the staffing issues as well. But we do budget towards higher census as if COVID was not a thing, based on previous year's census and actuals. And that is how we did 2021's as well. Since we have adjusted, or since the budget was originally put in, our staffing situation has gotten worse. And that is part of the reason for not admitting. So that may be something we need to look at as well.
Yeah, I guess my feeling is that our staffing situation, although I'm sure COVID hasn't helped, I don't think it's going to go away if COVID went away. I think we're still going to have the staffing situation. So we're still going to have limitations on what our census can be.
I agree. I agree with you totally on that, Dave. I do.
Okay, I do have a spreadsheet up, what we budgeted for was what we call 91%. It actually was 90.9%, the way the numbers came out. So 91% equals 125 per day average campus wide.
I think myself personally, I think we're way high in that with our staffing shortages that we have had. And I really don't believe our staffing shortages are going to go away if COVID went away. If COVID went away tomorrow, I still think we have staffing problems that we have to address. But I think we have to budget in reality that we're not going to have that many people, that we're not going to be able to have that many people in there with the staffing shortages that there is.
If I may add something in there as well. So with that staff, with the budgeted census of being higher, we are budgeting fully staffed. So then that would, if we budgeted less census, I would propose that we also budget less staffing numbers in there, because we also have the anticipated expense of staffing those households. So then if we did go down in census on the budget, to adjust that as well, we would also go down in expenses on the budget for the, or if we go down census, we would go down in expenses as well as revenue, because we would then take some of that staffing cost out. So even if we don't have the staff in the building, we're not necessarily acquiring that cost. So if we kind of how we're going right now with our budgeted census is high this year as well. But when we are low census, we aren't paying for those staff either that we don't have. So it does ebb and flow with that. So as you can see, our numbers this year, we are keeping up with the adjustment of having less people in the building and then having less costs due to those less people as well. So I guess it's based on what we want to do as a projection, but it would pull both down, both revenue and expenses.
To change the census mix, we would then go and we would review the dietary budget, the labor budgets, the supplies budgets incrementally. So.
And I totally understand and agree with that, but there's a lot of fixed costs that stay the same. So with less census, you don't make up all that money. You end up having more expense because there's fixed costs.
Right, and the cost per day, when we look at the cost reporting, the cost per day per room would then, in the end, it will increase because of the reality is our census is lower. Also, there is COVID dollars that aren't budgeted in. If we're going to use any COVID dollar grants and apply those to 2022, if there's any left over, or if there's any new grants, that's another item out there that we don't know.
Mr. Chair, if I could add.
Yes, go ahead, Keith.
Yeah, when it comes to budgeting for NDC this year, it is definitely unique, because you're also not only trying to manage the impacts of COVID and the staffing situation, we're also budgeting increase in staffing for PM homemakers, hoping to help address some of the staffing concerns, not all of it. We're also budgeting, and we will in round two, what you had asked, or what's being considered as far as increasing of wages, hoping that increases the staffing, which would allow you to open up. So, multiple things are shifting around here, trying to address multiple issues, and we're in the COVID scenario. From a budgetary standpoint, and I think Carmen or Jane alluded to this in her comments, that we do adjust on a monthly basis, on more or less a day-by-day basis. I'm assuming, if we don't need as much staff or whatever, making adjustments to operations to keep budget within line with the amount of people that we actually are serving. But from establishing a budget perspective, if you're trying to make measures to get to full staffing, to be able to hire staff, increase your wages, add the PM homemakers back into the mix, you may consider leaving your budget at what your target is. It doesn't mean that's what your actuals are going to be. You still should be adjusting those at least on a monthly basis to stay within, keep your costs down and keep your revenues to cover those costs. But from establishing a budget, if you're trying to raise wages, if you're adding the PM homemakers and you're making other adjustments to try to get back to full staff, we're trying to get back to full staff as well with the budgeting and the staffing plan and all the adjustments that will be included. So that's one of the thoughts that comes to my mind. Yeah, we could cut it down to what we're actually at right now, but then are we going to be back in 3 months into the year adjusting the budget if all of a sudden, hey, we're successful in all of these efforts to raise wages, to add the PM homemakers, we're getting staff back in, now we're having to go back and rework the entire budget.
I can add that is similar
Hey,
to what
Mr. Chair.
happened. Oh, sorry.
Just a second, Mike. Go ahead,
I was
Carl.
just gonna add that is what happened in 2019. That is the year that we reopened Arrowhead. And that is the scenario that we did have. We budgeted a low census and then ended up having a higher census and had to do budget adjustments for almost every line item in the whole NDC budget because we were maxing out our budget due to having higher census. So that is the scenario that we had in 19 as well.
Okay, Mike?
So, listening to Dave, I like to be realistic, but it also sounds like there's some unintended consequences if we do lower it or lower it too much. Would it affect our ability to get grants? Are grants based on our total budget? Are grants based on what we didn't make because we didn't keep up with the budget? How does that work for grants then, Jane or Carmen?
Well, right now, the provider relief funds, we have a choice to report lost revenue either based on budget or on actuals. And we are using actuals because they seem to show a better picture of what's happened. So that's a great question. But from what I see from provider relief funds, we'll be using the actual results.
So using the actual results, it wouldn't make any difference how we set the percentage or the number, the census
Correct.
number. Is that correct?
Right.
Okay. And it's kind of a tough problem. I'm sorry, it really isn't a tough problem in a way to say, oh, hey, we're doing better than we had planned. It's a lot nicer than looking and saying, hey, we're doing worse than we planned. I'm kind of looking at Dave's idea and it just does seem really high for the next year as far as the census projection goes.
Sarah or Steve, do you have any comments on that?
Not really.
Go ahead, Steve.
I just thought that this new wage increase should help with the jobs, and we're going to have to give it a little bit of time here to see whether it works out or not. And I don't know what the full capacity is. Is it like 125?
137 is max capacity.
137. So we're like at 1/5 below our intentional goal here. I don't know how much more help we need staff to be running at full capacity. But I would hope that with these increases in wages that we can hit that. And I think we got to give it time.
Okay, so
I have a
General-
question.
go ahead,
I'm
Sarah.
sorry. I was just wondering, what is the possible increase in wage? I guess I haven't heard that. Is it 50 cents or 5% or 2% or what?
So it is completely based on the class comp study of
Okay.
industry standards, so I don't believe it'll be across the board the same percentage. It'll be based on
Probably
each
not.
position and what the industry's current is to keep us competitive with other healthcare entities.
We do anticipate, Mr. Chairman,
Yes.
that when it comes to the CNAs, they're grade 2, that the adjustment will be to make that step 1 a minimum of $15. So the PM homemakers actually are the only grade 1, and we've projected that cost. That's part of what Jane mentioned earlier. But we do anticipate moving for grade 2 to that $15 an hour minimum, because we think we need that just to get them in the door. And Carmen's correct about the comp class study. We've been ballparking 5%, but that's a really, really big ballpark. And we'll have to see. We hope to have those numbers sooner than later, hopefully before the end of this month, but we've got to hold our breath. I was going to, as I listened to the conversation, ask Carmen, given the state of finding nurses, affording them, or what they ask for in salary being something else, just finding nurses, given the shortage, what census do you realistically think we can and should aim for, that you expect we will be able? What census would you, is it the 90% that you put in there? Do you think that's actually realistic, given the rates of referrals and the availability of staff?
Referral wise, as it's been picking up a little bit more, I guess that really depends on COVID, and if that continues out how it's increasing right now. I think referral wise is more based on COVID than the staffing wise is based on COVID. So referrals, we have seen an uptick in them, but just like last year when we had just a huge decline in referrals, that could happen again if COVID continues to increase, because that was a big part of that. We had a lot of people that wanted to go home. They didn't want to be in a nursing home. And if our regulations increase, if we continue at the same trend we're going, I doubt that it'll be long before we have closures again and more regulations and more restrictions. So that can also greatly affect our census. We just don't know. As Keith said, there's so much unknown with all of these things. And then as far as staffing, also, as Keith said, with the increase in wages and the PM homemakers, obviously that's going to take some time. So I don't know if that is realistic or not, based on if we can find people. Based on our exit interviews and everything, wage has been a big thing recently, as well as just being overworked, which a lot of that has to come from, you need to have more people because people are leaving because we don't have enough people. So that's a big circle that we just keep repeating. So some of these additions, if we can get people in because of wage, maybe more people will stay because there's a better outlook going forward. So that there's a lot of positives from that we just don't know what the effect might be yet. I would say if we are budgeting without COVID kind of idea, then that was the direction we had. Previous to COVID, we were, even with our staffing shortages, which have gotten worse, but what they were before, we were in the 130s. So it's not undoable, but that it was only a year and a half ago and we were in the 130s. With also having staffing shortages. So I do think we could hit that 120, 125 mark if raising the wages and having the PM homemakers really does keep and attract staff. So it's really hard to judge, because even we were in a staffing shortage then too, and I think we maxed out at 135 at that point. So it's hard to guess what is going to happen from that. So I wouldn't say we want to go any higher than that, that's for sure. I think the 130 and to 135 was an anomaly that we may not see again in any near future, but higher than the 110 that we're 111 that we're currently at, I think is doable.
Okay, with Dave, with your blessing, I think we'll move on with 125, but if you're not comfortable with it, we can still discuss it more. I kind of have my reservations at 125 also.
I'm only one person, so
No, I know, but
I just have my reservations. I think those 11 people from the 125 down to the 111 can, I don't know if I'm right or wrong, but I'm guessing that's close to $1 million revenue in the year. And it just bothers me that maybe we're not budgeting in reality.
Anybody else? Mike?
Mike,
Can't
you're
hear you,
muted.
Mike.
But I'm okay moving on.
If Dave's okay, that's fine, but I just soon see it down to 120.
If I could add something, Chairman
Sure.
Johnson.
Sure.
So our budgeted census this year, as you can see in the packet, was well higher than we've been consistently. And we have been able to keep it within the expenses that we're getting revenue wise. So that would be the only thing that I would say would be a good sign that we would be able to do that again, even if we don't meet that 125 census. We were budgeted for a higher census this year as well, and then been able to keep our expenses down low enough to not be over budget for the actual net income or net loss. So that would be the only thing that would be a positive of the outcome of, even if we don't hit that 125 census. We did have a similar scenario this year as well, and have been able to stay level with net income and net loss. So.
Mr. Miller, what's your take on this?
Well, on the one hand, I think it's easier, based on what Carmen has said, to set the census a little higher and then adjust expenses down if we don't meet it, than it is to set the census lower and then have to do budget adjustments if we exceed it. So that's one consideration. The other consideration, and I was going to ask Mr. Stray to speak to this, are we budgeting a deficit in 22 for the neighbors as we have in the past?
With the updated projections, no.
Okay, and if that's the case, then my inclination would be to go with the census that our professionals are indicating, the 90, what was it, 90.1, Jane, or whatever?
Yeah, 90%.
90%.
91%.
Because it is easier to adjust expenses down during the actuals than to realize we're going to exceed and have to keep coming through with budget adjustments.
Okay, well, from what I understand, or from what I'm hearing, I think we should move on with the 125. Is there a motion to add the 3 adjustments? I'm sure we need a motion on that, so.
I think a motion acknowledging the increased revenues from the Medicaid, anticipated increased revenues from the Medicaid reimbursement, the increased costs of the PM homemakers, and I'm referring to the July 28, and the anticipated increases to the nursing staff would be in order as modifiers to the subsequent review of the remainder of the 28 budget.
Would someone make a motion to that effect, please?
I will, to the effect of what County Manager Miller said.
Sounds good. Motion been made by Supervisor Kinnear, seconded by Supervisor Jensen. Is there any other discussion on it? Hearing none, all those in favor say aye.
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 Opposed? Carried. Okay, back to the original, or back to the budget. Is there any way someone can share their screen?
Should be able to, yes. I can. Or Keith or Carmen, I imagine, but I can.
You want to do that, Paul? I do not. I've never done that before.
Okay.
So.
Shall we start with the east?
Sure.
Okay. Then I will Let me see here.
Well, I'd suggest starting with Central because that has the summary to start with at the
You're
beginning.
just being difficult.
I am. But that does have the composite summary for the campus.
Okay,
That's a good starting point. Thank you.
yeah, let me go back, since I had already queued it up. And then Keith decided that he would mess me up. I'm going to go back here.
Sorry, I'm good
Financial,
for something, I guess.
got it. And you want me to go to Neighbors Central.
Correct.
Hold on a moment here. Neighbors Central. All right, and there we go. Now, I will share my screen. Oh, no. I guess, no. I have to figure out which one I'm sharing here. All right. Is that right?
Yes, and if you could, yeah, just blow that up a little bit, please. There you go.
Okay. So that's the overall.
Correct.
Here's Central. Okay.
So what's on the sheets is the original, the top page was the overall for all three and then combined. And then this is the second page is the just for Central, and then going further down is line items for every different GL code basically for the Central neighborhood. And some of these are repeated on each building and divided in thirds, and some are different based on the building that it is in. So for example, food is different on the building it's in due to census, as well as medical supplies. And then sometimes for some reason, one building has used more heating than another building. So those are adjusted as well, but some are simply just divided by 3 if it is a fixed cost.
Okay, so if as I look here on page 3, are these expenses or revenues first?
It's hard for me to see.
I think those are revenues.
Those are
Those
still
are
revenues.
revenues.
Those are the
Revenues are at the
revenues,
top.
okay.
So
Yep.
these
Alright,
are
so-
revenues.
Okay, so why the 23% drop in revenues on the medical supplies?
That is a formula based on a spreadsheet that feeds into this.
Mhm.
It's medical supplies. If we have fewer private pay people paying for medical supplies, or fewer Medicare A people using Medicare supplies, it would drop. And based on historical usage, if it was over budgeted in previous years, we aligned it to what the actuals were.
Okay, so the 22 budget as shown here, 36.4, is comparable to the 37 2020 actuals versus the 47 21 budget. Is that what I'm hearing?
Right. This budget shows the 2020 actuals. I'm not sure if all your departments do the actuals, but I thought it was important to put that in just to give a perspective of what really happened.
Sure.
So-
And then,
Oh,
Go ahead.
sorry, if I could just explain a little bit of how we do this process, since we have so many different line items, probably more than the average department in the county, is that Jane and I meet on every single kind of sub-department, or I guess division of the neighbors, and go over every single line item and compare it to actuals. And then what we budgeted last year, we look at 2020 actuals, as well as how much we've spent in 21 so far. And then prorate that out for the whole year and go over every single section. So that's why there is some changes. It's based on what we thought we might have used, or got in, spent, used, whatever it is, if it's in a revenue or an expense, and then based on what actually happened and what's currently happening in this year and projected for the end of the year. So all of those numbers are adjusted, and we do that with revenues as well as expenses, and especially for the expenses, we include the manager of the sub-department here. So for example, for nursing, Paula is involved, as well as our purchasing individual, and then for dietary, the dietary director is involved as well.
We meet. Yep, we meet
Yeah, we meet
together
on those.
and discuss with each sub-department. So it's lengthy. Also, with an increased Medicaid census, we're going to have less medical supply revenue. because that is
Right.
include, a lot of those are included in the room and board rate. So that was taken into consideration as well.
Okay, it's a minor thing, but what happened to bed hold? Why is there 0 now?
We didn't budget for bed holds. It was incorporated into the room and board rate as the average.
Is it a line item we're gonna drop off in the future, maybe?
Well, in Central, if we don't have a 94% census, we can't charge Medicaid bed hold, and very few private pay people choose to pay for a bed hold when they know our census is low. If it was a full occupancy and they knew when they came back from the hospital that they may not have a room, then they're going to pay that bed hold. But honestly, I don't expect any Medicaid bed hold in 2022 based on our occupancy.
Okay.
For the central building
For
specifically.
Yeah, that's what
Central.
we're looking at. You're right.
Yep.
Thank you for that. We are looking at Central. Explain real quick the bed tax adjustment, the difference here. We've got
The
a note,
difference
but
would
the
be
note which I
based-
don't understand.
That's how much per day, and we're budgeting fewer private pay days. So that should be going down. Yep.
The bed tax is individually charged out to residents, so, or their power of attorney, whoever is paying for their stay. So when we have more Medicaid census, we do not charge the bed tax to that. We cannot.
It is a fee that the state charges us. It's a per bed fee every month, whether or not the beds are filled. And hospitals do this, have the same issue. We pay the state basically for our inspections and monitoring.
At one point in time, there was a demand for nursing home beds, so you paid to have them basically. So at this point, there's not as, we haven't, the state hasn't maxed out the amount of nursing home beds there, but people would actually like sell their beds. So that's the historics behind that. So we pay to have licensed beds.
Well, I can see that the 3,600 in the 22 budget is much closer to the 20 actual. But it does make me wonder about the 21-18, why it was such a larger number, but suppose we don't need to dwell on that too much. We're trying to pull it back to something more realistic.
Yep.
Okay, intergovernmental charges for services, the 70% adjustment, what's driving that?
That is the increase in the supplemental payment from the state. They
Medicaid?
increased it last Medicaid supplemental payment.
Okay. By the way, for the committee members, I did this with the highway committee as well. Please interrupt with any questions of your own as I scroll through these. I tend to focus in on the ones that kind of jump out as being somewhat an anomaly. But any of these line items, please tell me to stop, back up, or whatever else. Okay. And having said that, the rehabilitation number here, the 8% drop, what do we think is driving that? Less use of Central for short time?
That is true. And based on historical average, like the 20 actuals were lower. With the Medicare payment, the PDPM payment model, we're less therapy driven and more comprehensive person driven with nursing and other items factored in. So therapy isn't, as we say, driving our boat for Medicare, and the usage has gone down somewhat.
I can, if the committee remembers, that was PDPM was the adjustment that we changed from RUGs to having a more in-depth payment model for Medicare, which Medicaid will soon be also adjusting to the PDPM model as well. But it is more driven about the actual cost of care that we provide to residents. So it's primarily driven by nursing and medical care costs instead of just the number of minutes that a therapist is with the residents. So the cost of, or the revenue we get from therapy goes down, but then also our cost that we pay to the therapy company goes down.
Okay. Moving on to expenses, these first ones are salary and benefits. I think we've gone over that pretty well. maintenance contracts are driven by IT for the most part, I assume, yes?
Correct.
And our software.
What is this internal financial services? Why the 54% jump there?
That is our, the cost of the billers and myself. We added a billing position and the intent is for my salary to be reduced as I pay more attention to other departments. And we are cross-training and getting our billing more comprehensive.
Okay.
Those
so-
are the financial people.
Okay, all right. See a big adjustment on office supplies, but the numbers aren't big.
Office supplies has been kind of a difficult one that we have had a hard time costing out to each department. So right now, if you can see all the way over on the left, it has administration. So these are for the administration sub-department, and they'll later be nursing and dietary. Office supplies, we have had a hard time. We tried to cost them out to each individual cost-centered department at the neighbors. So they've just been kind of moved around. So overall, we've kept the office supplies cost the same. It is just budgeted for in different departments.
Okay. These are all pretty small numbers. Nothing to get too excited about. Bad debt? 33% increase. Jane, what's that?
Well, it was it's an amount that we come to for expected write-offs. I work with the auditors at the year end to then project the following year, what we should be projecting based on I recommend to them. In 2020, we had a lot of bad debt. And we don't see that we'll have that large amount again, but we want to budget just in case something happens based on the amount of payment plans we have.
Okay.
Yep.
Then we get back into salaries and benefits again. So we've talked about it unless anybody has other questions.
And now we're jumping into the nursing department specifically.
We jump into the nursing department.
Of Central.
The central nursing department. RN pool voluntary, we're showing a pretty substantial 365% increase. Want to address that?
Sure, that is our pay that we give when someone voluntarily picks up. So it's a little bit confusing because we use the word pool for both agency staff as well as this actually like sub payment group that we give an increase in wage if someone picks up a shift. So if one of our employees says, I'm going to pick up Saturday night or whatnot to work the empty shift, and we give them an incentive to do so that we can fill shifts with our own staff before relying on pool or mandation pay, which is a little bit further down. That's when we have to tell a staff that you are required to stay. So we give an incentive for people to do that voluntarily. And we have had an increase in people doing that and using that. And we have been promoting that more as we are in a staffing crunch and crisis right now, because we would rather have our staff pick up extra shifts and give them the incentive than pay for an agency staff or have to mandate people, just because that is also a morale issue of it is much better if someone chooses to stay and get an incentive versus being told they must stay.
And we do expect there to be an uptick in people volunteering to take on extra shifts.
We're going off of actuals on that, of what we've had in this year. That was one that we've had a lot of increase this year on, because we've been increasingly having the need as well as trying to promote that and tell people you can get an extra bonus pay or bump in your pay to pick up a shift.
Why is life insurance expense in red? I mean, it's a 79% increase. I see that, but.
Life insurance has been adjusted. There was an error in the PEP.
Okay.
So that number is now 3326.
Oh, that's much better than the 5.8 then. Okay.
Yep.
All right. There's that office supplies again. You know, if we achieve nothing else, we'll talk about office supplies today. Membership dues, moving on.
So now we're getting into the actual supplies that we purchase for resident care. So that is completely driven on census as well as case mix based on how we can bill it.
Okay, so when we see 36% increase in the incontinence supplies or 63% on the billing medical, which it says includes oxygen, what's driving that? Is census?
It is census as well as actual. So that is one that we do project out based on what current usage is. It is all based on what our current case mix is. Those can fluctuate drastically just based on needs. So incontinence supplies, if we have 80% of our population that's currently incontinent, we're going to go through more of that. And it's completely based on resident to resident. So we basically go on, we take what our current is for, if we're doing it in April, the first 3 months, and then project it out for the rest of the year and try to make a realistic number. But it completely fluctuates based on the people that are in the building.
Okay. Looking at the rest of these numbers, although we've got some large percentage variations, the actual numbers themselves are pretty small. Unless anybody has any questions. And then we're getting into what's this section here, Carmen?
This is MDS. So this is back to wages, salaries, and benefits. So MDS nurses we've talked about it a little bit earlier because that was one of our resignations. They do the minimum data set, which drives our reimbursement. So it is just another part of the nursing department, but we do separate it out because they are different employees and have different costs.
All right. We eliminated here on Medicare Part B, it's got 0 in there. It was never very much, I know, but I'm just curious what changed that.
We are changing the way we post those expenses because pharmacy and Medicare B really are not compatible in a nursing home as far as expenses. We shouldn't have any Part B expenses to pharmacy. So we are recoding those in other places.
Okay. Committee members, again, interrupt me at any time if I pass over something that you'd like some explanation on. Okay, what section is this, Carmen? NDCC Social Services?
Social services for the central building.
Okay.
And then the majority of that department is payroll related things. They have a fairly minor budget.
Very minor, I can see that. And then this one here is life enhancement. Again, we got the salaries and benefits up here. No startling changes. Then we get into dietary for Central.
Dietary expenses have gone up. The food has increased. We applied some COVID dollars to it in 21. Not sure we can do that in 22, but the cost per day per person is going up in that department.
What's this federal ER Social Security? Why is that in red?
Was that, what number do you have there?
13,000.
13. It is now 10,139.
Okay,
That
so
one didn't seem
adjusted
to
back. Okay.
calculate correctly. Yeah.
Okay.
As Jane said, the dietary department has seen some significant increases, especially in, I believe meats is one of our biggest ones. It is due to the increase in costs from COVID related expenses. COVID has skyrocketed food costs, so we're trying to be as realistic as possible.
All right. Then we got purchasing. Are these red ones also adjustments, Jane?
Let's see, what we're in purchasing.
We're in purchasing?
Yes. Purchasing had an error in the PEP that has been corrected, but I had to put those numbers in there because they were in the PEP. Yep.
All right. Well, I'm glad the one got adjusted, seeing as how it was off by 21,000%.
Yeah. So that helps the bottom line in version 2, you know, to take that out of there.
Sure. And we got medical records.
Similarly to life enhancements, a very small budget.
Property owners. What does property ownership mean?
Property and
That-
ownership is the things that we have, so like telephones, any insurances, buildings, equipments, stuff like that.
Okay.
And depreciation is seen here as well.
Yeah, I see the Gatsby building, the depreciation expenses will highlight. The bistro, do we expect the bistro to be open in 22?
We budgeted as if it was, so similar to the, as if COVID wasn't a thing. Currently, we are not looking at opening it anytime soon as COVID is ramping up. We were having discussions about opening it until the last couple of weeks / month has seen a dramatic shift towards the worse in terms of COVID. So hopefully, if we have an increase in vaccinations and everything else, that would be something we can open up. But at this point, we're not, but we budgeted it as if it was, so that we at least had the dollars in there to open it. Obviously, without it being open, we're not incurring any expenses for it being closed.
And if I could add to that too, here's a really a good classic example of why you budget normal operations. If, let's say, the decision is made in mid-January, that conditions would allow us to open the bistro, but then if we have to go through a budget adjustment to have the budgetary authority to do it, there could be a 4 to 6 to 8 week delay in having that budget adjustment approved all the way through the county board. So
Senior meals, let's see.
Senior meals is increasing their in volume. That seems to be a stable increase. So we've increased the budget dramatically in revenue and expenses. So we did double check that will still balance and is not a drain to the county cash flow. So that's good. This year, we went beyond budget already for senior meal expenses for the meats and produce and that. So we did an internal adjustment from the bistro to senior meals. It doesn't affect the bottom line. It's something that can be done in with Keith's and Paul's permission. So we did move from line items to line items, some food costs budget.
In senior meals, we did renegotiate rates for as well. I believe we talked about this a few meetings ago with the ADRC, and we will be doing that on a regular basis every year to make sure that we're keeping up with our increased food costs and that our rates that we're
Absolutely.
receiving from them as well.
Yeah, because it is intended to not merely be an altruistic service by the neighbors, but actually something that renders a positive net result.
And we currently are rendering a positive and plan to keep adjusting that to continue to do so.
But we can see here on your budget how everything, produce, meats, dairy, bread, canned goods and frozen foods are all up. And that's consistent with what we're all hearing just for our own budgets for groceries. Okay. Natural gas is quite a drop. What's that about?
If Scott is still on the call, I think he has more knowledge about the actual workings of the natural gas and everything, but that is off of realistic or of actuals and going off of, we had budgeted much higher and we were coming out very low on natural gas due to how we're using it. And then we went off of actuals because as you can see, actuals for 2020 were only $9,000. So we didn't drop it quite that low because we didn't want to be under budget if for some reason that was an off year. So we put it in between the two to have a realistic number.
During our meeting earlier with Scott, when we did our department meetings, he mentioned the geothermal had an impact in reducing our natural gas usage in the summertime, I think he said, right, Carmen? It was summertime cooling that it
I'm
really
not
helped
sure
with.
the actual mechanical jargon on it and how it actually works, but I do know that it was based on our actual usage and how I know we've talked at length about the use of the boilers versus the heat pumps and all the different workings of our heating and cooling system here at the neighbors. And the changes that have made have affected the cost and the actual usage of some of the either natural gas and electricity and things like that.
I have a question, Chairman.
Yes, sir. Go ahead, Steve.
I was wondering about the heating and the lighting.
Sure.
Don't the natural gas run the heat, or how is that?
So our heating
Explain that to me.
our heating system is fairly complex, and we have heating. Each room has a heat pump. So we do have boilers and heat pumps. So there's some natural gas as well as some electricity that goes into that. So that heat and lighting is basically the electric bill. So it does, our heating system uses both natural gas as well as electricity. Steve,
You're muted,
Supervisor
Steve.
Jensen, you're muted.
Mr. Chair,
Yes, sir.
Yeah.
going back to the natural gas, I just want to comment that propane went up about a third this year. And so I don't follow natural gas, of course, because I don't use that. But I would guess that if propane is going up, natural gas would go up also, somewhat at least. So I just want to throw that out there. I would like to hear Scott's comments, but he probably didn't stay for this, which I understand, but
Oh, I'm still,
something to think about anyway.
Scott, are you still there?
I am still here.
Why did natural gas go to 28,000 in 21 supposedly to from 9,000 in 20? That doesn't seem right to me.
So what we did, we looked at, as Carmen and Jean had explained, when we went through the budget process here to get these numbers, we looked at the actuals of 2020, which is 9,000.
Okay.
21, we had budgeted 28,000. We felt that was really high. So we did reduce it down to take the money and put other places. We didn't take it down where we would be under budget, so we still have that cushion there. As far as the heat system, the geo system does not use any natural gas. That's all electricity, so that'll fall under the heat and lights.
Okay.
It's in the wintertime when you start supplementing the geo system with the boilers. When the geo system isn't keeping up, then we turn on the boilers, we supplement with the boilers to help heat. That's when we start going through natural gas. So it's really dependent too upon the type of winter you have. If you have really cold stretches, you're gonna use up more natural gas. So our plan of reducing was, we felt that we could reduce that based on past, that we had it inflated a little too much.
I think the 15,000 looks good for this year, for 22.
Thank you for that explanation.
You're welcome.
Okay. Go ahead.
Yes, I was wondering, is it cheaper to run the electricity or cheaper if it was to use more natural gas?
It would be cheaper to run the electricity on the geo system, pulling the heat out of the ground. Unfortunately, when we get in real cold temperatures in the wintertime, you just can't get enough heat out of the ground for the whole building. So we do have to supplement with the boilers and use the natural.
Okay. Okay. Thank you.
You're welcome.
I see we have a big change in our housekeeping on our contractual consulting service. What's that about?
So that has to do with how we were being billed for Scott's people.
Okay.
So we just kind of cleaned some things up when it came to the difference between Scott's custodians that are contracted employees and then the facilities people who are also technically contracted out to us from the facilities department. So we were just cleaning some things up that had been previously put in the wrong place.
Okay, so it's not a case of them donating their salaries back to us. All right,
Unfortunately, no.
okay. I'm just looking here. The billable therapy, on the physical therapy, are these just projections based on actuals here that account for these changes?
Correct.
Okay. Same here.
Mhm. As also goes with the changes on the revenues up above. So that how we mentioned that there'd be a couple of different things that changed with that.
Wouldn't it
On the billable therapy commitment items, it includes the Advantage B contracts that we serve. So if somebody has not Medicare Part B, they're long-term here, they've got Medicare Part A and B with Security Health Plan or some insurance that's in that category.
Okay. Then I come down to the bottom here, and given the prior motion, which recognized the additional revenue projected from Medicaid reimbursement, do we expect this to zero out the net?
Not for the central building by itself, but for the overall campus, yes. So
Okay,
the central building has historically been, but if it was a standalone, it would not be as strong financially as the other two. So the other two then support the downfall of or the shortcomings of the central building. So
because the central building is set up more with more beds for short term,
correct.
and that's harder to predict.
Yep.
And yet it has to be staffed.
Correct.
Okay, what is the attitude of the committee to go through the same level of detail with respect to West and East?
Any suggestions? If
They
that's
are very similar. The
Yeah,
differences would be in the revenue and census projections, and the expenses would be very similar.
Yeah, I see no reason to
No.
carry on, so.
You tell me what you want to do. I will note that it's 12-12 right now.
Yeah. Anybody really want to go through the other two that with a fine tooth comb, or we should have already looked at it, correct?
Is there any specific questions on the other two that we could answer if we don't go through it that detailed? Is there questions that are potentially different that you've noticed on the other two?
I have seen none.
I didn't either, so I'm okay not going through it with this detail. I think we're going to come up with the same questions or the same things that we noticed in this one.
Sure. And hearing that, go ahead, Steve.
Mr. Chair,
Or
I'd
Mike.
just like to thank County Manager Miller, because I think it was an excellent exercise for us as supervisors to go through it and look at it like that. Whether we've done it before or not, it's always nice to confirm and learn new. So thank you, Mr. Miller.
I have to agree. I kind of like it that way too, so. So if we don't want to do anything different, is there a motion to approve the 2022 budget?
I'd like to make a comment before we do this. And it still bothers me with the census that we're predicting. And I understand totally with budget adjustments and stuff if we budget too small. So I'm thinking that we should look at what the difference in revenue is between 111, what we can efficiently staff, and say the 125, and lower the revenue a little bit, but leave the expenses the same. Now, I'm not saying drop it as much as I would be comfortable with, but I would rather plan on taking money out of our general fund than thinking we're not and end up with a 500,000 or 600,000 deficit in the end. And so I'm just throwing that out there. If you figure $200 a day, and I don't know what Medicare pays right now or Medicaid, what Medicaid pays, that's the cheapest. But if you figure just the $200 a day, I think that comes up to a substantial amount of money. And if we if we lowered the revenue a third of that or a half, and just worked off those figures and expected to have a deficit at the end, if it worked out that we did, that would be great. But I would rather have that than expect to come out even and end up with a $600,000 deficit coming out of general fund.
Keith?
Mr. Chair, yeah, may I suggest, I'm kind of going along with, I think what Chairman Bartlett is mentioning here, what we could do, if you really only want to impact the revenue side, and that is the nature of the beast here for this being a fee-based operation, we could lower that revenue projection from 10%. We could drop that down to 8%, or we could drop that down. If you wanted to make a motion or build into your motion here that you would, I guess, recommend to the executive committee that staff review the revenue projections, accept the budget as amended with those adjustments that were approved earlier, and present an updated revenue projection. Whether you want to set a target or if you want to have staff analyze that further and come back with something along the lines of what Chairman Bartlett is bringing, we could do that as far as what's presented in round 2. Because again, we will have some adjustments in round 2 that we've mentioned, and we still have some unknowns. So we could reduce that down to 8%. I mean, we're trying to balance a lot of things here. So if the committee would be, comfortable with that, we could take that approach.
Okay, Carmen?
I would just have one question or request with that. If we were going to lower a budgeted census, even without the food cost of care, those things of revenue or expenses, if we're lowering the revenue, could we at least lower the expenses for staffing? Since that's the reason that we're projecting a lower census, would be because we don't have the staff to fill it. Our budgeted staffing expenses is if we're fully staffed. So if we're saying we don't have the staff to fill the building, we're going to lower census, then we should also not be budgeting for the cost of staffing those people. If they're not going to be here, if that's how we're looking at the census, is based on our low staff. Because right now what's in there for the PEP spreadsheet is fully staffed. So our expenses for staffing is up to maximum fully staffed.
If I may, Mr. Chair, I appreciate what Carmen's saying, and I think that's correct. Our budget ought to reflect our projected census, so it ought to reflect that on the expense side, which is staffing. But Mr. Stray's suggestion may address what Chairman Bartlett was talking about. Right now, we were projecting that 10%. If we project 8%, that's, I don't know what might work out to, but if 10% is 640, 8% is going to be 100,000, 200,000 less.
120,000 less.
120, there you go. Does that address, Chairman Bartlett, would that address your concern, do you think?
Well, I think the difference between the 14 number of census over a given year is close to $1 million in revenue. And yes, it goes a ways towards it, but I was thinking that maybe we should lower our revenue a third of that $1 million. So I guess, that 124,000 goes a ways for that, but I would lower it maybe a little bit more. because I think realistically, we're not going to have that revenue. And in the end, I would rather, in the big scheme of things, in the whole county of budgeting, I would rather realize that we're already taking money out of the general fund if realistically we think that's going to happen, so that we don't have a false sense that we can take money out of the general fund to fund something else, all the good things that we do. And then, in the end, we end up having a bigger deficit in our general fund than what we think. I don't know. I'm just trying to be realistic and look at the big picture of the whole county. And in the end, it's going to help Keith's job trying to give us a balanced budget, an example of a balanced budget in the end. I'm just trying to be realistic.
Well, if I may, Mr. Chairman, suggest, I think we want to rely upon the expertise of Carmen and Jane and Keith when it comes to the mechanics of the budget, that is the revenues, what they're based on, the expenses, what they're based on. If it is the consensus of the committee, and I don't know if it is, but if it is the consensus of the committee that a census of 125 is too high, I would recommend, rather than saying, well, let's lower the revenues here or raise the expenses here or whatever, or budget for a deficit, let your professionals do that. Go ahead and pick a census level that you are more comfortable with. If 125 is too high, split the difference between the 111 that we've got right now and the 125, you're talking to 14. Would it be 7 more? So you'd be talking to a census of 118 or 120. What makes the committee comfortable? But I would encourage beyond that to rely upon the expertise of Carmen for adjusting the budget accordingly, both on the revenue and expense side.
Well, I guess that's where I would be comfortable is, I like Mike's suggestion of dropping it down to 120, but I also heard the reasons for not lowering expenses as much because of all the budget adjustments that we have to do, and that creates a hardship on Carmen's team. I totally agree with Carmen that if we're lowering revenue, we should be lowering expenses. But I realize that we hope that that doesn't happen, and that we don't want to cause a big hardship on them to have to go through a bunch of budget adjustments. And that's why I suggested just lowering the revenue.
And the labor won't hit a budget adjustment. The labor cost is forwarded right through the payment system. So nobody's paycheck will get stopped because we're over budget.
Right, but having said that, on your month to month, if we don't adjust the budget, you will have a deficit larger than maybe what was budgeted. So yes, mechanically, bills will get paid, payroll will get paid, but unlike vendor payments that are hard stopped in the system, payroll does get paid. So I understand, and the hard stop on budget does not stop business from happening. It's just an administrative hurdle that Carmen and I experienced in 2019 when the budget was ultra conservatively lowered at a very low census. Things took off, and then we got to September, October timeframe, and we're hitting budget issues. Part of guess where some of the comfort level to a degree on my part, and I'll just offer this to the committee for your consideration. This is all fee-based. It's not tax levy, so we're not generating tax levy. We're not going out to taxpayers and saying, give us tax levy in December, January, February, July, if you do the payment program, and then all that money sits in the account. Here, this is all fee-based. We charge it out. So like you're doing on a monthly basis, Carmen and the team are reporting out to the committee, and you're adjusting your operations to line up with your net profit or net loss. So it's unlike taxes where you get one shot at that major revenue. Here, you're adjusting it on a monthly basis, pretty much almost on a live basis. So it's not like a tax levy but I also agree with Chairman Bartlett's concerns here on the fund balance. So I do agree with Mr. Miller on maybe the approach that if you agree to a census level that you're comfortable with, then turn it back to maybe suggest that it comes back to staff to update the numbers for round 2, like we've talked about all these updates that are going to take place, and then present those in round 2.
I would like to see, personally, I would like to see the census drop to 120. I really would.
120,
I'm sorry, Jane.
120 or 118 would be
I would
7.
like 120. What's the rest of the committee feel? Good, Sarah, Mike, okay,
Fine
yes,
with me.
Carmen.
I just wanted to, as a reminder that dropping the census 120 will also have all 3 of the buildings will have different adjustments on that. So it's not going to be across the board. So it's not, the overall budget will change by that, but each one will be slightly different, just as a reminder, since they are all separate.
Yeah.
So they will look different.
Okay, so can we go, I suppose we can't really go ahead and approve this at the 120, or can we approve it at the 120 census?
You can
Yes.
recommend approval of the budget as modified by the census being adjusted to 120.
Okay, is there a motion to that effect? Anyone? Steve moves. Is there a second? Mike seconds. Is there any other discussion? Chris, you've got all this down now, right? Good.
Come on,
All those in favor say aye.
Aye.
Opposed?
Aye.
Carried. Okay, thank you. Review vouchers and financial reports, Jane.
Wow, we're still here. Okay.
Yeah.
Yeah.
Any question on the vouchers? Floor mats and water bills and such.
I didn't see any.
No questions. Okay. Get through my pages here. The campus census, of course, we talked that Medicaid is above our projections and private pay is below our projections. Medicare is somewhat below. VA and insurance are nominal. So no big changes there. The aging report. The aging is at 1.228 million. Last month it was at 1.221, so it's up a little bit. And that is fine. I think we had an increase in Medicare census, so that takes a bit longer to pay. And some of the old stuff bumped down to the over 365 days. But we are still collecting on payment plans and doing pretty well. The staff is getting fine-tuned in their training, and I see good things on the horizon as far as the aging.
I'm sure you have told me, Jane, told us, but what is your interest rate you charge on that?
We charge 0 right now because the computer cannot do it. And what was happening prior to me.
I can do it.
Yeah, we could do it. And then what was happening is it was a manual system and it wasn't being charged fairly or consistently. So my thought was to reduce any legal repercussions on how we charge interest. We either do it all one way or don't put that risk out there.
Really?
Yeah, and if I could, Mr. Chair, too, when you're dealing with federal and state dollars, they have restrictions and they have nuances. So to have a program that covers all of that, all of a sudden the administration costs on that could eat up any interest earnings that you have. And then if you have legal issues because somebody contests it, it gets to be a real.
Okay.
And we could only charge that on private pay balances and sometimes those are hard to collect, and that just is a thorn in collecting.
Okay,
So,
thank you.
the software system will be updated, I think next year, and they are talking about a module that will charge interest to all balances, within parameters. So, good question. Pool staff. And of course, the RNs, we don't have any expense for RNs on pool staff because they don't have any. And the monthly averages are below what we saw in 2020, probably because Central is closed, or Central, that part of Central is closed. Any questions on the pool staff expenses? Okay, then to the P&L. So our budget monthly occupancy was 90%, and we came in at 82% this month. So Central being not to full capacity is still affecting us there. If you go down to the senior meals revenue, you can see on an actual basis that it's $13,000 ahead of what we projected. So that's good. And then their expenses to senior meals is a little bit higher, but still netting out all right. The COVID money for the payout, the employee retention payout, has been posted and is in the actual year-to-date column. Any questions on the revenues? We're down by $200,000 to budget. That's including the COVID payment. Expenses, the total expenses of $664,263 compared to the revenue of, that's the budget, total expenses of $8,000,002 and the revenue of $8,000,001 leaves us with a little bit of a loss there. We add depreciation in that hasn't been posted to the general ledger yet. I keep that out until it's actually posted so we know where we're at there. And then the bottom line is with expected additional provider relief funds, a $257,000 profit.
Anybody have any questions?
I'd just like to hear Jane say that again because it sounds so nice.
I like it, yeah.
Well, it does show profit, although the caveat is the COVID reimbursement was $445,000. So negative $200,000. And then if you think of depreciation as not a cash expense,
Yeah.
it's not a cash expense that we would claim from the general fund as a budgeted item. That's kind of where it gets wishy-washy, where we were looking at it as all cash basis on here, but the depreciation is not a cash expense. So that's a little more protection in the budgeting process too, as far as the tax levy.
Sure.
Any other questions? I think that's all I have.
Dave?
Yeah, I'm just looking at total expense. That's up, it's $664,263 over, correct?
Over the budget. Yep.
Yes.
Well,
Yeah.
no, the expenses, the actual year-to-date is $7,006,000, and we budgeted expenses of $8,000,002. So it's under.
Okay.
We're under in
So it is
expenses.
under.
No.
So it's under that much. All right.
Yes.
Okay, thank you.
Carmen?
Just also like to add, I know we kind of drew out the COVID expense or the COVID revenue that came in there that even some of that out. Those are all specifically related to something that we could claim as a COVID expense too. So we can't draw out those expenses as well as we can that money. So those expenses were embedded in. So some of those, so if you got rid of the COVID expenses, you get rid of that COVID revenue. So even without those, it would be at kind of at the same spot because we did claim all of those things as COVID expenses that we wouldn't have had without COVID. So without COVID, we wouldn't have had that money, but we also wouldn't have had the expense too.
That's true. We don't have a minus 445 for payroll expense.
Yeah.
That's true.
Any other questions? Jane, do you have anything else?
I don't have anything else. Oh,
Is there-
provider relief, I do one thing. Provider relief funding reporting is due at the end of next month. In October, would you like a report on what was applied to neighbors from provider relief funds?
Yes.
A short description?
Yeah, that would be great.
Okay.
Yeah. All right. Is there a motion to approve the vouchers and the financial reports?
I'm sorry, I have one more question, Mr. Chair.
Okay. Go for it.
Jane, I'm looking at this on the second page where the neighbors of Dunn County per resident day analysis.
Okay.
And it says average daily census actual 128. I was just confused by that. If I'm looking at something wrong, because if you take all the different houses or the different buildings, it doesn't add up to 128.
Right, that is not correct.
Good catch.
Okay,
Mike.
I was just confused again, so.
No,
I'm
you
done.
weren't confused. I should run these past you to make sure I don't have any other typos here.
Now, is there a motion to approve the vouchers and the financial reports?
I'll make the motion to approve.
Sarah's moved, Mike has second. Is there any other discussion? And hearing none, all those in favor say aye.
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 Opposed? Carried.
Yeah.
Is there anything else before we adjourn? Thank you, everyone.